We are in a field or industry that is constantly evolving as science and technology advances. The College of Nursing produces nurses that are going to be leaders and advocates for patients.
Well, the faculty, they have been phenomenal. They are truly here to see us succeed. They often say, you'll be an EVP leader wherever you go, and they really strive to make that a reality.
And as faculty, we have the ability to really influence what our future healthcare providers are going to look like. We can bring our different experiences to the table and also have the ability to really help them to understand that what the world is going to need in the future is very different than what it has needed in the past.
I am working closely with students not only in the classroom setting but as well as in the hospital setting. And so as a faculty member, I try to get our students to really embody the kind of nurse that they would want their family member to be cared for by, in addition to keeping in mind their own health and wellness.
I've discovered that I'm able to work effectively under pressure, easily adapt to a new environment, and think critically when placed in unforeseen circumstance.
My experience as an online learner has been actually life-changing, and I have learned that I can do this. I can be a nurse, I can be a leader in evidence-based practice, and I can help transform lives.
We dream.
We dream the future.
We educate.
We educate the future.
At the College of Nursing, research really turns dreams into reality for the first time in many cases. And together, I feel like we do what others might call impossible and always inspired by our patients to never give up.
Our College of Nursing is so tremendously innovative, and we are transforming health and the future of health by our inspirational spirit.
Our approach to democratizing innovation is unlike anything you'll see at another university or health system. And the reason that we do this is that we know the evidence shows us that the people who need to be leading innovation are those at the front lines.
I believe that we have to do work that is across the lifespan in order for us to be able to come up with the solutions to many of the healthcare crises and problems that we see. We have diversity of ideas, diversity of thought, and we have diversity of scientists that are looking at the work.
I really feel like empathy and compassion drives all of us. So nurses listen, nurses care, and nurses come together to usher in change when change is due. When you pursue your dreams that are stemming directly from the stories and lives of your patients, quitting is really not an option. It's about human life, and that is always worth fighting for.
Our College of Nursing is a leader in almost everything that we do, from evidence-based practice to academics, and now innovation and wellness. So having a new center like this, or having a new space for innovation, sets us above almost every other College of Nursing in the world, where we will become the leader in healthcare innovation.
We discover.
We discover.
We discover the future.
Total Health and Wellness has been very innovative in transforming our care that we deliver into a team approach, as far as including all the health disciplines in not only our patient care, but how we teach our students to provide care to our patients.
The good thing about having RNs in primary care is that they can help these patients with the tools and the skills that they need in order to manage their health at home. But when we have RNs in these practices working one-on-one with patients, they do feel more empowered in order to be healthier.
With Bern's role and our Buckeye Wellness team and how much effort we put into changing this culture, we've shifted the paradigm from had to get to, where people are now motivated to, internally motivated to partake in these wellness programs to see the benefits for their own wellness and well-being.
The FULD Institute is all about changing healthcare and bringing healthcare decision-making, patient care decision-making based on evidence into becoming the normal way we make decisions and drive healthcare. It's an underpinning of the healthcare of the future.
With our Buckeye Wellness innovators, we can utilize them to find ways of communicating best for their faculty and staff.
We actually were doing telehealth prior to the pandemic, not merely on this scale, but we knew the need was there and that we needed to meet our patients' needs in not the traditional brick and mortar way. Telehealth is going to be here forever now, and it needs to be.
Nurses are able to help patients actualize their health and realize the strength that they have inside of them by partnering with them and by empowering them, educating them, and being a resource for them.
I would venture to say that we are doing the best job of creating evidence-based nurses and clinicians as they graduate and as they move into our healthcare spaces. That's what those spaces need.
We deliver.
We deliver.
We deliver.
We deliver the future.
We are.
We are.
We are
We are
transforming the future of health.